Welcome everyone to today's webinar, Improve Financial Outcomes Through Patient Self-Service Capabilities. I am Brian Zimmerman, and on behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So we will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We will have a series of poll questions during today's webinar. You can submit the answer that best applies to you directly on your screen in the slides box. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are happy to help. With that, I'm pleased to welcome our three terrific speakers from Rectangle Health: Brian Doyle, Senior Director of Enterprise Sales; Christian Drbal, Director of Enterprise Sales; Michelle Dowling, Senior Director, Marketing. Before we turn the floor over to these great presenters, I'd like to kick things off by introducing a few poll questions, and we'll have you submit your answers now, and we'll review the results towards the end of the presentation today. So with that, we'll start with this first poll question. So how would you rate your organization on its current digital patient payment offering? Robust, we offer many ways for patients to pay and finance their care, and patients are satisfied. Good, we offer some ways for patients to pay and finance their care. Average, we rely mainly on traditional methods of payment, which seems satisfactory for our patients. Less than average, we rely mainly on traditional methods of payment with a lot of manual effort. Needs improvement, we struggle to get paid by our patients. Just give you a few more seconds to answer that, and then I'll move to the next poll question. And so for poll question number 2, would you describe your organization in terms of technology? Very forward, we have implemented many digital processes and it works well at our organization. Somewhat, we offer some digital capabilities. Average, we rely mainly on traditional methods. Less than average, we don't offer much technology and focus mainly on manual-based processes. Needs improvement. We don't offer technology and manually record our patient interactions. And again, I'll just give you a few seconds here to answer, and then we'll move to the next poll. And for our next question, how would you rate your organization on operational efficiencies given the market dynamics and financial pressures? So very prepared, our organization is well equipped and process efficient. Prepared, we have good processes in place and there's always room for improvement. Average, we manage the day-to-day operations well, but had to make many changes to cope with the pandemic crisis. Less than average, we are working as we did prior to the onset of the pandemic and need to implement new workflows. Needs improvement. We are struggling to find the right balance and set up processes for the current environment. Again, just a few seconds here to finish up. So then for our final poll question, what do you think are your organization's barriers to implementing new technology solutions? Operational barriers, financial concerns, staff training, all of the above, or none? I'll give you about 10 seconds here to finish up, and then we'll get going here. Okay, Michelle, I will turn the floor over to you to get things going.
Awesome. Thank you so much, Brian. And thank you to the audience for attending and participating in our webinar today. In our discussion, we'll talk about ways that we consume information has truly altered our expectations in almost every area of our lives. And no matter what age or gender or even what generation we may belong, many of us are tied to experiencing our life in some capacity through our mobile device or on the internet. And this picture depicts this instant, always-on availability and accessibility of information and how it influences the way we manage our daily lives and drives our preferences. This pertains to how we want to interact at the practice as well. And we recognize that the consumer shift to digital commerce that had been progressing for years well before the COVID-19 pandemic even began. And we've witnessed a natural progression in our healthcare to embrace these digital capacities and capabilities. But now, 7 months into the pandemic, research shows that consumers' increasing preference for online and digital payment options is most likely permanent. So today, we look forward to discussing what it means to the dental practice. First, we wanted to tell you just a little bit about Rectangle Health and who we are. For the past 27 years, Rectangle Health has worked exclusively on solving the needs of healthcare practitioners. We serve over 21,000 providers nationally and process over $6 billion in patient payments per year. The company was founded in 1993, and since inception, we've focused solely on healthcare. And even back then, the founders of our company saw a need in the market because providers were struggling to get paid by patients. And they knew this trend would continue to increase. And in 2012, we introduced software called Practice Management Bridge, which truly evolved our company into a software company. And Practice Management Bridge enables a connected, unified experience with hundreds, not thousands, of practice management systems. And from inception to today, the heart of our solution is to simplify the experience by which our providers get paid from our patients. And with that, I'll turn the presentation over now to my colleague, Brian.
Thank you, Michelle. And thank you, everyone, for joining us today. We do appreciate it. Just a little bit more about what we offer and what Rectangle Health believes in. We believe in providing technology to enhance our providers or our partners' current workflows. And we really do that by providing 4 main pillars inside of our solution. The first and most important is unifying all forms of payment. As I go through, I'm going to point out a few troublesome points we have in the industry today. But what Rectangle Health's goal is to do is to provide one centralized platform that allows you to have consolidation when accessing anything having to do with patient payments. There has been a drastic shift in consumerization. Patients want to pay the same way we pay in retail. That is statistically proven, and patients always have their cell phones on them. They want consumerization inside of healthcare. Our goal is to bring that functionality to your practices. We have a seamless flow or a payment posting integration to every single practice management system out there. So whether it's Dentrix, SoftDent, EagleSoft, et cetera, we're able to take that data and post that data for you in live time. And then lastly, scalability, which is actually going to take me into who we serve and who we are. Rectangle Health, as Michelle said, has been around for over 27 years. We started down market, one doctor, one operatory practices, and we still do that every single day. We have now since grown into the mid and up market or commercial market vendors. We work with some of the major DSOs and organizations throughout the country. But what this does is show that we understand the dental world. We've been in it for a long time. We have practices, again, ranging from one office through some of the largest DSOs in the country. There is nothing or any size that our clients or our partners ask that we can't provide them. Anything you need, we'll be able to custom build it for you, which then would allow the patients to have a more streamlined contactless payment solution, regardless of size of practice. What we see most often in the industry is the practice or provider having to access different touch points inside of the practice management system or using disparate systems. This will inevitably cause confusion for both staff and patient when making a payment or registering for an appointment or scheduling an appointment. Most providers want the flexibility to choose their payment software or vendor that posts back into the practice management system, for this instance, Dentrix. But then the finance manager, well, they need payment plans, and the ops manager needs a patient portal, but they have Open Dental and CareStream. Well, then the front desk needs some type of registration tool, the clipboard, handing over paper, scanning all that in. That's going away, mainly because of COVID, but we're progressing technology. But they're on EagleSoft, and then there's another system. And Inevitably, this leads to multiple systems, multiple touch points. It becomes increasingly complex when a patient calls in and says, what do I owe? Your network might have a perio office, an endo office, an ortho office, and a general office, all using disparate systems, disparate vendors. This makes that conversation and billing process much more convoluted than it needs to be. Now, the level of consolidation doesn't really exist in the marketplace today, except for Rectangle Health. Rectangle Health will provide a centralized platform that offers all forms of these contactless patient payment and engagement solutions, regardless of practice management system. Our goal, or what we do, is provide consolidation within the industry. This is proven to improve the relationship between patient and staff, or patient and provider, mainly by reducing touch points. A patient wants to be able to do this at the comfort of their home. Our consolidation will allow them to, in fact, do that. Now, the provider and patient both face different pain points when dealing with the payment process. So Christian and I will walk through the provider side, and then I will handle the patient side.
Yeah, you bet. So thanks, Brian, and thanks everyone for joining. Now, I'm sure everyone listening in today is familiar with the problems that we're talking about. You go out and acquire a new clinic or a group of clinics. They're using different systems other than your current affiliates. These are real problems that providers experience. So you're bouncing around, you're going to your bank for statements, you're logging into multiple systems to track where the funds are coming from. You're managing and coordinating the organization across these different systems is a problem. For example, you might have several clinics on, say, EagleSoft, another number of clinics on Dentrix, while you just acquired another clinic or two and they're using CareStream, all while your plan might be to, say, transition everyone over to Planet EDS. Keeping that patient payment information together, it's not easy. It's a problem. We all know this. Capturing full balance of payments from patients, it takes work. Patient responsibilities are continuing to increase. Requests for flexibility in how those balances are paid continue to grow. The problems when you have multiple systems and attempting to reconcile these systems together, it's inefficient, it's inaccurate, and there's better ways to solve these problems.
Absolutely. And to take that another step further is it also affects the patient's experience. In today's environment, patients are shifting how they want to pay and interact with their healthcare providers. Think of how we order a cab these days, right? We don't call a taxi. We don't hand over cash. We go on our phone. It looks at our face, and a car shows up. We literally get in that car, and we get out of that car. That's what consumers want in today's healthcare environment. Patients are actually actively shopping their healthcare experience based off the solutions the providers are offering. So if somebody doesn't have digital registration or scheduling online, a patient will go to the next practice down the road. Studies show that the more satisfied a patient is with their billing experience, the more likely they are to pay. So by providing patients price transparency, engagement tools like a text message, we all have our phones. I actually have two phones sitting on my desk right now. We all have phones on us at all times. Allowing patients to register, allowing patients to send a question back to your finance department or office manager on their cell phone makes for a better user experience. So there is a direct correlation to improve in patient satisfaction, which inevitably leads to more patient payment. Now, these retail-like, as I call it, solutions, they've been making their way into healthcare. The main one that a lot of offices are actively using, and it's my favorite feature actually, is card on file. These features have been around for the last handful of years. Now, what happened in 2020, as we all know, is there was a tipping point that sped up the timeline because retail traditionally was about 5 years ahead of healthcare in terms of the solutions we were offering for payments and registration. Now, that tipping point is increased our timeline dramatically.
Yeah, obviously, COVID-19 disrupted healthcare and accelerated technologies that were already on the way. Contactless payments, online bill pay, card on file features have been pushed to the forefront for what patients want. Traditionally, retail, think of Amazon, Uber, and Netflix. Think of the technologies there and how we pay there. Since March, we've seen a massive increase of online bill pay, text to pay, and card on file. These options are not just what patients want and need now, but also it's what they're going to want and need moving forward. So once established, there's not going to be any reverting back to filling out the papers on a clipboard at the clinic, paying with the check. Think of when you first subscribed to Netflix. You didn't just go off and go to Blockbuster after that, or the first time that you downloaded your Uber app, you didn't call a cab after that. We're not going back to the ways that it was before. Rectangle's capabilities are proven to enhance the patient experience, to increase patient satisfaction. We're going to improve your in-clinic workflows and efficiencies. These technologies, they're not going away, and they're here to stay.
Thank you, both Brian and Christian. And to further support all the things that you were saying, I'd like to share some recent and compelling statistics with the audience that really supports the importance of adopting and implementing digital methods. As patient volume rebounds, we want to think about the patient's shift to contactless and digital experiences. As a byproduct, there are new expectations. So we found these three statistics that I wanted to share today. The first one is 80% of consumers who have shifted select activities online. So this means things like instead of going to the grocery store, they're now picking up curbside. They plan to retain their behavior when the pandemic subsides for two reasons. One, out of caution, and then also because digital offerings have improved. The second compelling statistic is that from a generational perspective, fear of infection is driving the baby boomers and seniors to embrace digital shopping. But we also see that Gen Z consumers and millennials are turning to digital channels specifically for their added convenience and for data security. So they each have their own reason for turning to digital. I think it's important for us to notate how it differs by generation, but how everyone has been impacted. And then there are those who are going into stores, but want to be able to pay without touching anything. This is definitely me. 54% believe it's important for merchants or practices to accept contactless payments, and 50% want to be able to pay without touching anything. So if we apply these learnings, we can hear that digital offerings are considered an improvement versus the prior way or pre-pandemic way of doing things. And we've heard that safety and security and convenience are important. And as we think about how to keep the practice truly contactless, we can meet patient preference by the power of text messaging. So these were four very compelling statistics that show that 98% of text messages are opened and 95% of text messages are opened and responded to within 3 minutes of being delivered. So this powerful connection illustrates the significance of text messaging, especially in an environment that is vying for our attention. 9 out of 10 consumers would like to communicate with businesses through text message, whether it's sending an alert, sending a reminder, or any type of back and forth communication. So this really pertains to the way we are now interfacing and communicating with our practices. And additionally, it was also reported that consumers are 64% more likely to perceive a business in a positive light when they've been directly communicated to. So one may think that phone calls are really the most personal. However, people are looking to say that phone calls are becoming a thing of the past when it comes to communication. And it showed that 50% actually prefer text messaging rather than phone calls. So, and I'm sure you can see yourself in some of these examples, especially with regard to preference. And what people desire in order to make the most of their time is concise flexibility and convenience. And thus the demand for communication through text messaging definitely helps us to save valuable time. How we help really is we become the healthcare technology solution here to meet these evolving demands on ways that the patients want to engage with practices easily and conveniently through what we call patient self-service. And what we wanted to highlight today is that in the past, these digital ways of managing our lives may have even felt too forward. But now, post this shutdown, we've realized that technology has surpassed generations, age, or even technology savviness, how we feel about handling technology. And as patients consider their care and get back to elective treatments, the practice schedule will fill up. Changes that were made before the shutdown will remain. And these statistics that we discussed can all help us attest to this new perspective on how the practice can communicate with their patients, how they can obtain payments. And that's where we're going to dive in a little bit deeper. So next, we're going to share how the implementation of digital tools allows the practice to engage with the patient. So Christian, I'll turn it over to you from here.
Yeah, you bet. So here's what we do to solve the problems that we see. Rectangle Health is going to provide you all the forms of contactless payment options. We're going to give the patient the options that they're asking for. Every solution that Rectangle Health builds is designed to fill a need. So we're going to give you several ways to get that patient's card on file with signed authorization for future use, whether it's the point of registration, at the point of care, in the clinic, or post-care. So, once that patient's card is on file and you know the remaining responsibility, you have several options to efficiently capture that payment balance. Whether it's a quick courtesy call to the patient, let them know the balance and that you intend to run the payment, a text notification with a customized message, text to pay, text reminders, as well as robust online options. We're going to white label and brand to your organization, to your affiliates, with mobile capabilities built in. However you want your online capabilities to look, we'll custom build those to meet your needs. So Rectangle Health, we're going to customize based on your needs and your workflows. Go to the next slide. So not only does Rectangle provide you with the ability to offer the patient what they're looking for in terms of payment options, our solutions are custom designed to meet the needs of the staff at the clinic and at the admin level in the dental world. Rectangle Health is going to provide the clinic and the admin level one centralized system that unites all systems and brings together all points of patient payment from all of your clinics, regardless of the system that they're using in clinic. You're going to be able to access any patient, any payment plan, all from one login. Our updates are seamless. On our in-house gateway, we're going to remove any need for you being involved in the updates or to insert patches or to involve IT for local updates. Rectangle creates and gives you full control on the administrative side to give staff access at whatever level you deem necessary. And we give you the capabilities you need in order to run your organization efficiently.
Thank you, Christian. So what we wanted to do here, we would love to show you a lot of our software and solution, but time being what it is, we decided just to show one feature we have, and that's a text-to-pay option, which I'm going to talk you through here. The text-to-pay option is a very streamlined and consistent way to make a payment. like I said earlier, we all have our phones. A text comes through. Text has a 98% open rate. We could white label this and custom brand it. This just routes the patient to a secure URL, that allows them to make a payment. Now you're going to notice here that there's some custom branding. We will carry over your logos or keep it generic. But what we could do is just simply run a payment. We could add fields you want us to accept. We have the same technology we have as depositing a check. All of that technology is built in to our text-to-pay option. Patient would simply go ahead and fill in their information, address, zip code, email, etc. Now keep in mind, this is secure. It is on our servers. It's PCI compliant. It is encrypted. Once they do accept this payment, and again, just fill in all of this information, they're going to send this payment, automatically get a receipt. It takes about 30 seconds. The staff will also get the receipt showing that that was paid. So what we've just done there in about 30 seconds is engage the patient, give them price transparency. Hey, you owe us $25. They make a payment. It has the same technology we have on our iPhones with, my iPhone has 4 credit cards stored in there. I could pick and choose which one I want to use, or I could scan the credit card or simply type it in. It is designed to be turnkey for your organization and has an increasingly high rate of conversion from opening that text message. So that is just one example of what or how we can improve the patient's experience. Patient expectations regarding their, again, experience have changed dramatically over the last several years. This isn't to say that the clinical outcomes will be less important, of course not, but new patients are looking for exceptional engagement experiences to tie with the fantastic service they're getting at a medical or dental office. Now, the more convenient options providers offer their patients lead to more satisfactory experience, which inevitably leads to more revenue being generated by the provider. Allowing a patient to pay, engage with the practice, reschedule an appointment. I always think of OpenTable. I don't really call restaurants anymore. I just go on OpenTable and make an appointment. It's the same concept. But providing all of these options in more flexible ways will lead to less stress on the patient coming in. It allows them to feel safer and more convinced that the environment is safe because it's touchless, it's contactless. It reduces a dramatic amount of redundancy by the practice, the staff at the office, as well as reduce administrative work for the patient. I could scan my insurance card, for example, without mixing up the group number or member number, which everyone on this call is familiar with. But all of these touchless, contactless options, they're ready to go. The technology we've been discussing for the last half hour, it's not new. We as consumers have been using it for years. What has changed, though, is the patient's willingness to adopt has dramatically increased, adopt these practices. So lastly, what our goal is at Rectangle Health is to become a partner to our providers, our clients. We have been in this industry for 27 years. Christian and myself and Michelle have been doing this, I think, for combined like 36 years. It's a lot. We want to be involved in your patient payment revenue cycle process, your engagement process. Picking a patient vendor, it's a commodity. You've probably all gone through that experience and quite honestly probably had a bad experience. We do consider ourselves a partner to our clients, and that's how we've established a brand and staying power as long as we have. We would love to hear, what pain points do you have? A lot of people on this call are probably saying, well, we have some of this. Great. Step one done. Now let's see what other pain points you have and let's fill those pain points. We do not believe in taking an off-the-shelf product and trying to squeeze it into your workflows. Every office we've ever worked with is a little bit different than the next. We're going to ask you, hey, what do you want this to look like? How do your patients react when we keep a card on file? Here's what we suggest, and we'll build out a solution from there. The flexibility and level of customization that we provide, it's been built by the feedback we've gotten from our 10,000, 50,000 some odd providers using this solution. It's also been built off the patient's willingness to adopt. So we're always staying ahead of the analytics, a big trendy word. We're staying ahead of the analytics, seeing where the new trends are coming in, and we're adopting those practices into our solution every single day. So we're going to get into some poll questions and some Q&A, but I do want to thank everybody for joining. Obviously, we would love to connect with you in the future. If nothing else, we could just have a conversation. I love meeting new people in the industry. We're always around just to bounce ideas off of, hey, we like our vendor, but what do you suggest on this piece? We're happy to have those conversations. The ultimate goal is to make the patient's experience better, reduce staff redundancy, provide one consolidated solution, and we do that for you regardless of what type of practice you are at absolutely no capital expense. So I am going to turn it over to Michelle, and we'll take a look at the poll questions.
Awesome. Thank you, Brian, and well said. And the reason why we wanted to talk about these poll questions now is to show everyone on the phone and listening in and watching the webinar just how much these things relate to individual organizations. So let's roll through how you rate your organization on its current digital payment offering. So at the top of the list, people are tied at, they think that they are doing a great job. And for that 31%, that's fantastic. And here we have another tied exactly at 30.8%, that you feel like there might be more room to increase ways that we can satisfy our patients on how they come into the office and how they're paying for treatment. So that's great. And for those that feel like there's room for effort or there's ways that they can consider, I hope that you feel that we've touched on some ways that may give you a next step in your process and improvement for getting paid. The next question was how you would describe your organization in terms of technology. And here we see that the large majority really is that we offer some, and that makes complete sense in this context because given the environment, we had to shift. We had to embrace new ways of coming in and out of the office and keeping things safe and secure for our staff and patients. So this makes total sense for a shift. And now if you feel like it's somewhat, again, we hope that we showed you some new ways to talk and communicate with your patients and to also capture more payment methods. Talking about operational efficiencies, given these dynamics, 46% feel prepared, and that's significant. And then we've got some that are tied that feel that they were very prepared and average. I think this question really wants to hone in on also how you feel about going forward and what unexpected environment situations may occur. So I would really encourage our organizations to think about preparedness and readiness as you think about the fall, as you think about the turn of the season, and really how you want to go into 2021. It's important for us to take stock at this time to say, what else can we do? And again, kind of why we wanted to reflect back on some of these statistics and show you how important it is for patients that as your volume ramps back up, as people come back in after missing appointments or getting back to elective care, that you have these digital components waiting for them.
And Michelle, just to make one other point on that, we've actually seen a massive increase in patients needing more flexible options. Let's just say it's a payment plan. With the world environment we're in today, a lot of people either lost jobs or were furloughed for a little while. So offering flexible options like partial payments, half today, half next week, or card on file for $1,000 for 6 months, whatever those policies might be, we've seen a dramatic increase in patients not only asking for those, but needing those. So something as simple as card on file with a recurring charge has been a great asset to make the patient feel more comfortable in their financial policy, and then obviously increase revenue for the practice. Right,
absolutely. Thank you, Brian. I can't think of a better way that describes contactless payments either when your card is on file. It's literally no contact. Right. Okay, so last question for the poll was, what do you think are your organization's barriers to implementing new technology solutions? One of the things that, look at that, all of the above, operational barriers, financial concerns, and staff training. I think when we talk to organizations, those are the things we hear the most. And I'm glad that we can recognize that these are some of the things that we consider. And I see a few of the Q&A questions rolling in that really address this. So I also now like to turn it over 2 questions for the audience, because I can see that some folks want to talk a little bit more about these barriers and how we can help overcome them. So Brian, this first one is for you. This one says, how do you train offices on these digital methods? Could you talk a little bit about that?
Yeah, absolutely. It's a great question. The number one feedback we get, or concern, whatever we want to call it, is we don't have the bandwidth to train our staff. Well, that's exactly where Rectangle Health comes in. We do provide concierge, white glove customer service. That obviously includes myself. I run our enterprise division. It includes Christian, who you'll have direct access to. But more importantly than us, you have a whole team. We're based out of Valhalla, New York, and outside of White Plains, that works just for you, in essence. We will schedule dedicated trainings. We give out all the cheat sheets and materials you need. We are involved, like I said earlier, in every aspect of this, or as much as you allow us to be. We do want to become a partner. So we actually take on a number of the training burden off of your organization. We just say, introduce us to who needs to get trained. We'll take it from there. So we do try to make that training process as seamless as possible. This is not like converting from Dentrix to SoftDent. It is not that large of a lift. We are there to just make sure people understand how the system works, mainly because we're already integrated on the back end. This becomes a much easier process at the front in-clinic process.
Awesome, thank you. We have another question for either of you. Is all of this applicable to medical systems, or is this only a dental system?
Yeah, that's a great question. Christian, I'll handle it if you don't mind. So we are medical dental. We have every vertical you can imagine. We work with all the main healthcare EMR, PM systems as well, Epic all the way down through your homegrown one. We started in dental, but our clientele now is almost 50-50. It's like 54% dental, 46% medical, and those numbers are probably a little off, but it's roughly 50-50. So we're in big healthcare, small healthcare, we're in hospital systems, we're in health insurance companies. So we do work with the whole spectrum of healthcare. So no matter what PM, no matter what EMR you have, we have clients utilizing it.
Thank you, Brian. And on regarding security and compliance, can we talk a little bit about our solution and how we work with security and compliance?
Yeah, absolutely. So all the big compliance issues out there, PCI, HIPAA, the new one's called P2PE. We have all of our certifications. We take compliance very, very seriously because we're in healthcare, and we understand that compliance is number one priority. So the second a card is transmitted, and by that I mean inserted, swiped, Apple Pay, it becomes what's called a token. All that really means is we are taking liability for that transaction. So we convert that 16-digit card number and we make it a one-time token. So this is a very high-level, secure way to run payments. It's actually the most secure way to run payments there is. So we have all the certifications and compliance regulations you would need. We have those, and we update those on an annual basis.
Awesome. This one is, how quickly can you implement this solution into our practice?
I like that question. So that's a great question. So depending on the size, of course, we could get you up and running anywhere from 2 weeks up through the, once we get over the 50, 100 location groups, it takes a little bit longer. But depending on the size of your organization would allow us, and your schedule, quite honestly, allow us to get you up and running anywhere from 2 weeks through, 90 days, depending on the size of the organization.
Awesome. And then I have a question here about we have a couple of questions about this subject, so maybe we can capture it a couple of different ways. Can you talk a little bit about cost and processing, Brian?
Yeah. So how we monetize our solution, we take on your merchant services, quite honestly. So there actually is no inherent cost to your organization. You're not buying software. You're not purchasing a SaaS-based model, nothing of that nature. We simply monetize this through your already established merchant processing fees. We just run it on our in-house system. So there's no inherent cost to your organization. There's no capital expense. You don't have to pay us a down payment or anything of that nature. We simply provide you the software. You download it onto your computers. Our team kind of takes over from there. And then all the payment processing would just run through our solution. And that's the only way we charge your organization, is exactly how you're being charged today to run credit cards. We just charge the same way.
Awesome. And another overarching question, Brian, that's coming through is, can we talk a little bit about monthly or installment plans? Can we talk somewhat about how we sell for payment plans at the practice?
Yeah, so our payment plans are all in-house. So we are not a third-party financing company. Now, we have partners that are, but we are not a third-party financing company. You would simply keep a card on file. Think of orthodontics. That's the biggest one out there. It's $200 every month for 24 months. Once you program our payment plans over on our gateway, it will automatically generate that payment and email the patient the receipt. We will not chase the patient or anything of that nature. We're not a collections company, but you can just set up in-house payment plans. So essentially the provider would become the lender in essence. And all of that would run through our merchant service, and you only get charged, the provider would get charged whatever the merchant service fee is. And the patient, if they pay on time, it would technically be interest-free. Now, just to piggyback on that, some providers do charge a convenience fee, but that's totally up to the provider. Rectangle Health does not do that.
Awesome. Thank you, Brian. And last question that's come through is, can you talk a little bit about your support model?
Hey, I'll take that one, Brian.
You got it.
All right. So yeah, great question, Michelle. We look at our relationship with our clients as a partnership. Along with that partnership, Brian touched on it a little bit, but Rectangle will provide concierge white glove support. So like Brian said a moment ago, but it starts with Brian and me. You'll have direct access to us, whether it's email, cell phone. You can shoot us a text, but we're along for your entire tenure with us. You'll also have a dedicated technician, customer service rep, account manager, customer success manager, implementation manager, et cetera, all dedicated to your account. You'll never have to dial an 800 number. You're never going to be placed on a queue and wait for a response. We even handle your annual PCI security assessments and send you the certifications once they're complete. You'll have direct access to us throughout your entire tenure. And we believe in that level of support for our clients and our partnering with you. So we look forward to partnering with you. We look forward to working with you.
Awesome. Thank you, Christian.
You bet.
And Brian Zimmerman, we'll turn it over to you to close things out today.
Yes, thank you so much. That's all the time we have for today. I want to thank Michelle, Brian, and Christian for an excellent presentation, and Rectangle Health for sponsoring today's webinar. To learn more about the content presented today and for a full demonstration, please reach out to the Rectangle Health team. Brian's contact information is on the screen here for you. Thank you again for joining us today, and we hope to see you on future webinar programs.
Thank you, everybody.